So with this, ladies and gentlemen, let's move forward towards the next speaker of the day. This man is really amazing. He is a public health specialist, chairman, Phoenix Foundation for Research and Development, continuing his excellence for the mental health profession. Please welcome Dr. Noor Zaman Rafiq, and we will listen his beautiful thoughts for today.
And thank you very much, Musa Sheikh. You have just talked about me. I'm really grateful. And I'm really grateful to Berkeley's and Musa Sheikh for actually running this wonderful program. When we talk about the voices of global women, this is going to be something that the women will be empowered enough and they will be having a capacity to take up their rights, to talk about their rights, to talk about various issues. I'm going to talk about the significance of mental well-being. So there are so many different issues. There is dropout of the child at the level of primary classes. Government has set up the minimum age criteria for marriages. And I have observed that in certain cases, the girls who are actually not even 16 years of age, they are getting married. They have got lesser facilities of mobility, or they are not allowed to go alone. They cannot go alone to any place. When we are talking about the urban areas or the mega cities, there are facilities available. Discriminatory attitude at home, discriminatory attitude of being from the so-called weaker gender, that is the women. So these type of discriminatory behaviors start right from the birth of that particular child or the girl child, and it goes on in the later stages of life as well. She's not asked about her choice for marriage. She's not asked about if she is interested in education. She's not asked about going for any type of sports and these things, and so on and so forth. Another thing which is observed is actually karokari, if exchange marriages and dowry. Due to those reasons, it has been seen that many women actually they get into many different type of mental issues. We'll talk about them later as well. They are not given a role in the decision making. Not even when she is pregnant, she is not allowed to actually talk about to go to a specific doctor, or she doesn't have any choice to actually talk about that. And in many cases, the girl is not taken to the hospital even if she has got some complications over there, and that is why the most of the girls, they actually die at their home, and that is why the MMR or maternal mortality rate is quite high. So many domestic cases of violence, including beating, including actually using different harmful objects as well, are being used by the husbands over there. There are certain health problems as well, which are not discussed among, between the family members even, not with the mother in many cases. And if there is some lump or something that particular girl is having, she doesn't tell it to her mother. And polycystic ovaries, that's another thing which is very common at the moment. And many girls don't talk about it, they don't tell about that particular problem to their mother. And then comes this papillomavirus thing, the HPV. Now, this papillomavirus, which causes the cancer of cervical, so they are not talking about it as well because of guilt, because of shame. Another thing is infertility. Now, these are four of the problems, and then urinary tract infections and other infections. These are some of the things that it is thought to be taboo talk between the parents as well as their girl childs. So the condition really progresses, and in many cases, this breast cancer thing is actually talked about when it's actually in the last stage. So for that reason, now keeping in view these health problems and keeping in view these cultural barriers, there come many different type of psychological issues. And these psychological issues or mental disorders, they start from the stress, anxiety, depression, being bipolar and schizophrenia. It is found out that in many cases the depression is actually there, and when many girls or women, they are bipolar as well. And anxiety is a very common factor due to different reasons. I have already discussed about. And schizophrenia is actually a little bit complex disorder. So having this stress, it is leading in many cases to suicidal ideations. And many of the girls or women, they are seen to actually go for the self-harm. And self-harm is another thing which is actually seen and observed in many cases, and that is all related with the mental health issues. How we can go ahead and we do some remedial measures for mental well-being? First of all, we don't have any well-being clinics for those purposes, particularly where the women can be taken, and particularly when we talk about the adolescent or youth girl over there are no centers over there, and these centers are really need of the hour, particularly in our part of the world, where the access to mental health is very little. Those well-being center and women-friendly centers, and in certain cases, they have got one-stop facilities over there, where they can actually provide the services under one roof to the women, including from screening, assessment, going up to the counseling, and going up to the even after screening to further referral. So when you have got these type of facilities, these are going to actually minimize the problems with the women. And second is there should be easy access for screening and assessment. For I talked about the breast cancer, and I talked about the cervical cancer. These are two of the problems which are actually concealed. And if they don't talk about it, if these can be discussed right in the beginning, then we can save many. When we talk about the prevalence, so the prevalence is maybe increasing day by day because of concealing it that that particular person is not having this problem. And most of the these health camps which are being organized by the different non-government organization or civil societies, these are held in the mega cities. But the person who is to be targeted, the girl who is to be targeted, the women who is to be targeted, they are living in some rural areas. So over there in the rural communities, health camps should be organized with proper trained people who can actually go ahead and do the screening over there for breast cancer particularly. So these can be done. Another thing is the laws are there. Laws are there for the women. The laws are there for actually different type of crimes. But unfortunately, these laws are not being implemented properly. So that is also a need of the day. Trained psychotherapists should be there in each of the women-friendly centers. Many women, they have to actually leave their jobs when they have got a baby, particularly because there is no daycare center in that particular office. And in certain cases, the depression also starts over there because they stop working over there due to non-availability of certain services related with their children. So they stop it. And secondly, when we talk about these trained physiotherapists, to learn or to study psychology is one step. After psychology, if you are not trained in that specific field, wherever you want to go, like if you want to work in a burn center, you should be trained in that. If you want to work in a well-being center, you should be trained into that. So proper training is required for the physiotherapist to deal with the women, and as well as to the adolescents, because adolescents has got other sexual and reproductive health issues as well, which can be discussed over there. So burn centers should be having the trained physiotherapists as well, and in emergency department where the cases related with this self-harm or suicide are brought up. So this should be over there. Coming down to the mental health theme of this year, which is very important, that is access to services. Now, the whatever I have talked about is related with that. There are, if the services are available, proper access knowledge should be there. The services should be focused. It should not be like that the services are actually being done same by same person. If a person is not trained to take up a person related with substance use disorder, she or he should not be actually doing that. So the focused services should be there, and it should be goal oriented as well. Every type of services are not needed at a specific place, but since these services are required, so the rationale should be there that the services should be, when we talk about the proportionate or the equity, so the equity should be actually kept in mind, and action should be taken according to that we should actually concentrate more on mental well-being. If a person is healthy as far as the mental well-being is concerned, many things can actually be improved. Thank you very much, Musa, once again for giving me the chance, and as well as the Berkeley's for coming up and talk about the in this wonderful forum of Voices of the Global Women. Thank you.
So this was Dr. Noor. He was talking about the mental health, and this was so enlightening. It's people like Dr. Noor is an asset for the society. He's a great supporter of the women and empowering them in the scale that he operates in. I want to thank you for joining today and giving your valuable thoughts.